we tend to give a fair amount of consideration to our waistline, whether rolling it to the sweet sounds of soca or shrinking it from way too much indulgence. But maybe we should spare a few more thoughts for what lies below the waistline. Today on Shak, we have Dr. Rashida Daisley, Medical Director of the Barbados Family Planning Association and Vice President of the Barbados Association of Endometriosis and Polycystic Ovarian Syndrome, PCOS. So, welcome, Dr. Daisley, and thanks for joining us.
Thank you so much for having me.
Yes.
It's a pleasure.
Excellent. So today I want to talk a bit about sexual and reproductive health, which means that people are able to have a safe and satisfying sex life, and they have the capability to reproduce and the freedom to decide if, when, and how often. Okay. So maybe we could start with what is the mandate, the role of the Barbados Family Planning Association.
Okay, so the role of the Barbados Family Planning Association is basically to bring these sexual and reproductive services to the persons and make it more accessible for persons. I think we'll get into it a little bit later, but obviously healthcare on a whole, and specifically sexual and reproductive health, there are a number of barriers to accessing it. So our mandate really is to make more affordable and accessible care for persons, regardless of their class, their ethnicity, especially their gender and sexual orientation.
Okay. Good. So, as the new medical director, or maybe I should say newish, because you've been there a little while, but still relatively new, I suppose. So what are your goals? What do you want to achieve by the end of your tenure?
Okay. So as my role as medical director, I do have a dual role. So I do work clinically still, where I would assess, treat, and manage patients with a variety of conditions.
Okay.
But obviously, I do have quite a large administrative role in terms of leading the clinic per se.
Mm-hmm.
I am part of a larger management team for the BFPA. So we do have our executive director, Anderson Langdon, as well as our financial controller, Miss Sonia Aline, and our executive assistant, Miss Nicole Gollop. So I am part of that larger team. But specifically for the clinic itself, I do want to raise awareness of the scope of services that BFPA offers. Because I think, especially when I first joined, some persons actually were not aware. Every week I get at least one patient that's shocked that we're actually still open.
Wow,
because I think the majority of persons remember the fire that would have occurred before I joined.
Yeah, that's true.
And right, so they're not aware that we're actually still functioning. So we do get patients that come in and not aware of that. So I do want to raise that awareness that we're in fact still here, and we're doing great work. Additionally, I want to broaden the scope of our services as well. So many times when persons hear family planning, they only think of like contraceptions or medical or termination of pregnancies. But we do offer so many other services, especially in a clinical setting. So we do offer GP services. And in terms of sexual and reproductive health, it's not just contraception and so on, but even my role as in terms of the endometriosis and PCOS, advocating as well as seeing patients, particularly in the earlier stages in terms of diagnosis of these conditions. We are very important in that aspect as well. But we also have a theater where we do some minor surgeries as well.
Okay.
Yeah. And additionally, I do want to increase the research that we're conducting at BFPA. So not only research from us, but other persons coming in that would be able to use our research to help to further certain awareness and information about certain conditions.
Okay. Well, that seems like a big, a long list of goals, but I'm sure that you will be able to achieve those at the end of your tenure.
Yeah.
So I was also wondering what you would say are the most significant challenges facing women with respect to their reproductive and sexual health. Based on what you've seen and,
Okay. I think definitely based on what I've seen, the first thing that we have to talk about is finances. Any medical care, financial barriers are right at the top of the list. And specifically in this new setting of COVID, because it has had such a significant economic impact on Barbadians.
It's true.
And since we rely so heavily on tourism and that sector has really been cut. A lot of persons have not been able to continue their healthcare access. So that's a big challenge. Additionally, even before COVID, economic implications can occur, things like opportunity cost. So many of the ladies, when they come in, sometimes they, for example, their pap smear, they might not have had their pap smear
Mm-hmm.
well beyond the due date. And
Yeah.
they're saying that obviously they don't have the time to take off from work. If they leave work to come and do this, they're going to lose a whole day's pay, or they're going to
Mm-hmm.
lose this. So things like that also do pose a barrier. Additionally, there are some other barriers, for example, psychosocial barriers, for example, stigma, particularly internalized stigma. That's more so in our society, because sexual and reproductive health is still quite taboo. Talking
Yeah,
about it,
it's true.
yeah, even with your physician or even some physicians talking about it, it is still quite taboo.
Mm-hmm.
So that does pose a barrier as well.
Okay.
And also the cognitive accessibility. Um, in school, we're not really taught too much about comprehensive sexual and reproductive health. So a lot of the persons sometimes don't even like have that a broad understanding of what falls under this umbrella. They might know like things about STIs and pregnancies, but things beyond that, like their menstrual health, what is normal in terms of menstrual health, they're not quite aware of that. So all of these things pose quite different but significant challenges to these ladies.
Yeah.
And
So
male, sorry.
yeah. So actually, that was where I was going next. Are there a significant number of men also accessing your services? Because I know that the BFPA does does cater to men, and maybe what kinds of challenges are they facing, if they're kind of different to the women or similar?
So we actually do have a specific men's clinic. So we have men, our men's clinic is on Wednesdays from about 3 p.m. till 7 p.m.
Mm-hmm.
And we do have a lot of men who come in there to have their prostate examinations as well as their PSA levels. So in particular, at our facility, we don't really see men having those hindrances to accessing the men's health care. But
Okay.
for men themselves, I think some of these same things would apply. Um, Men, we actually had our conference last year in November, and it was centered around men's health,
Mm-hmm.
because when we're thinking about things like equity in healthcare, a lot of the time we focus a lot on women.
Yeah.
Women's health is very big, but the men sometimes are kind of pushed to the wayside. And if we're talking about health equity, we really have to focus on them and really trying to get them to come in to have their checkups and so on. So I think that aspect of it, in terms of the health equity generally, not only in Barbados but internationally, looking at men can pose a barrier to them.
Okay. Okay. Well, at least some of them are still accessing
Yeah.
those services.
And I
So.
do find
Mhm.
a lot younger men are coming in for their prostate exams as well, because usually we see it particularly in older men, but
Mhm.
younger men are really advocating for their own health and coming in at an earlier stage to have their check.
That's okay. That's really good.
Yeah.
So I know that the Barbados Family Planning has been around probably since maybe the 50s or so.
Yeah.
Would you say it's, do people still I know you did mention the fire and people maybe, not knowing as much that they're still there, but is it
Mhm.
still like would you say it's still a prime option amongst the population for sexual and reproductive issues? And I know you mentioned some deterrence and that kind of thing, but I guess my question would be around, are like young people accessing your services as well? Um,
I think my fatigue would say yes. We have a lot of clients still coming into us.
okay.
Some days the clinic is just so, obviously not now with the COVID times,
Yeah, yeah, true.
but we still have a lot of clients coming through. So we're definitely still having the persons coming in. People are still aware of us, and a
Mm-hmm.
lot of younger persons too. So even like the persons coming to see me as a physician, that's one thing. But then we have patients who just come for their like testing, or if they just come for their contraception.
Mm-hmm.
So we do, yeah. So we're definitely still thriving.
Well, that's good. That is great to know. I'm happy to hear that. So you did touch on it a bit earlier about the importance of data in making the right decisions and creating policy and that kind of thing. So do you think there is sufficient research being conducted on reproductive and sexual health in Barbados and I guess across the region?
So there are some entities, for example, like UNFPA and PAHO and so on, that do conduct a lot of research, particularly around like STIs and HIV/AIDS. But I do still think that there's a deficit in other areas of sexual and reproductive health. For example, the menstrual health disorders
Mm-hmm.
that I would have mentioned earlier, those are still in deficit, and I do think we need to increase the amount of research we're doing there, not only quantitatively, like looking at things like incidence and prevalence, but a
Mm-hmm.
lot of the qualitative research, particularly for menstrual health disorders, how these are affecting ladies' quality of life,
Yep.
how it's going on to affect things like economics. So, for example, how absenteeism caused by menstrual health disorders might implicate in
Mm-hmm.
their person's income, things like that also need to be looked at.
Okay. Well, hopefully, hopefully we can get some more of that research being done. I guess as a follow-on, do you think that the maybe the deficiency, I would say, in the research is it that people are not necessarily as interested in this type of research, or is it that there's not sufficient funding? I'm just kind of curious.
I don't think it's that persons aren't interested. I have definitely seen an increase in the interest in these
Mm-hmm.
areas, particularly with the Association of Endometriosis and PCOS. So I
Right.
think a lot of it has to do with funding as well.
Mm-hmm.
As I mentioned earlier, um, economics around healthcare and things like sexual and reproductive health, that's still quite taboo. Sometimes the
Mm-hmm.
funds don't come as liberally for other areas of
Okay.
healthcare research. So yeah.
Okay, fair enough. So I guess that that leads me in a way to my other question, which is about you talked about taboo. The other question is about HIV rates in the Caribbean. Are we making progress? Are we doing enough? I was just curious about your view on things like that.
So we are definitely making an impact. I
Mm-hmm.
think and I'm not sure if the rates are declining as yet, but they're definitely like leveling out.
Okay.
And we in Barbados particularly, we do have a really good not only in terms of prevention of HIV, but the management of persons living with HIV and AIDS in terms of preventing like, further complications associated with the disease. Um, the HIV/AIDS Commission associated with the Ministry of Health is doing quite a lot of work,
Mm-hmm.
as well as smaller NGOs like us at BFPA. And there's also an NGO, one of our partners, Equals, that looks at LGBTQ community, who does a lot of work surrounding that area as well. So we are making strides.
Okay, that's good to know. That's good to know
Yeah.
that. So there's been a lot of discussion in Barbados about the low birth rate and the potential that for a labor crisis in the next few years. That's something we would
Hmm.
have heard our prime minister mention.
Hmm.
What would you say are some of the implications of the efforts to improve sexual and reproductive health? Given the challenges of an aging population and decreasing fertility rates.
So I think that's quite a complicated question.
I would definitely agree with you there.
Yes. So in terms of like the first aspect, in terms of sexual and reproductive health for an aging population, even working at BFBA, I do see a lot of older persons coming in who are still no, they're thriving and they're still
No, well, that's
go ahead.
encouraging. No, I was going to say
Yes.
that.
So they're definitely living their lives. So and they do come in, and I think obviously for a place like BFPA where persons are able to actually talk a lot more freely and don't have that stigma, because obviously we're known for that kind of
Hmm.
area. They
Yes.
do talk a lot more freer with us. But I do think that particularly among physicians and so on, sometimes it might be a bit more taboo in
Hmm.
terms of talking about that. But in the birth rate, because obviously we're Barbados Family Planning Association and we're
Right,
known
right.
for contraception and so on, I don't see the birth rate increasing anytime soon. Obviously, that's highly weighted on economics, because
Yeah,
I think a
that's
lot of
true.
the reason that persons are not having children is because it's very expensive to support even ourselves for the mother,
No,
I don't know.
no lies there.
Yes. So I think what we as a government we probably need to focus on is the general health of the aging population to ensure that these persons are able to lead a lot more dynamic lives, obviously including sexual and reproductive health as well, so that they can still be productive at an older age,
Yeah,
basically.
yeah.
Yeah.
Okay, that's good. Maybe someone's listening.
Yes.
So aside from your role at the family planning, I also mentioned that you are the VP of the Barbados Association of Endometriosis and PCOS. So maybe you can tell us a bit about your own experience with PCOS and the work of the association.
Okay. So I joined officially last year as a vice president, but I always enjoyed volunteering with the association. They do a lot of work, not only with these two conditions, but also with other menstrual health disorders, things like fibroids. They do a lot of work surrounding that. I myself have polycystic ovarian syndrome. I was diagnosed, I think, in either 2012 or 2013.
Okay.
And yeah, so it that itself has been a struggle in terms of managing the condition, because one of the aspects of its management is obviously healthy lifestyle and nutrition, because a big part of why the disease occurs are actually the cycle. That's a whole other conversation on its own.
Well, maybe I'll bring you
But
back to talk about that specifically.
yes. But insulin resistance actually plays a big role in polycystic ovarian syndrome. So in terms of managing that, it has been quite a challenge. But as my role as a vice president, what we have done a lot. So when I first joined, we were actually doing a school outreach.
Okay.
I would have mentioned earlier, in terms of the need for comprehensive sexual and reproductive health education, because we might at school we're taught about like the STIs and pregnancy, but we weren't really taught much about menstrual health, the abnormalities that can go on there. So
that is true. That is true.
yeah, yeah. So that was actually very, very enlightening. We went around to a variety of schools, and the young girls would have a lot of different questions, and they would get a lot of information from those outreaches. We do quite a lot of work in terms of corporate as well. So we do like lunch and learn sometimes.
Okay.
Before I joined, the organization actually produced a book detailing the chronicles of ladies who lived with these conditions. So it's called Invisible but Not Imaginary, and it's actually a very, very good book.
Oh, maybe I'll take it up.
Yeah.
Okay. So, I mean, you did mention interestingly enough about nutrition, and then because that leads me to the work that you do with the Barbados Childhood Obesity Prevention Coalition. So, I was just curious as to, what motivated you to get involved in that particular initiative. Yeah.
So that's also another personal interest as well. One of the, I guess, symptoms of PCOS is that sometimes you can gain weight very easily, and it may be a bit more difficult to lose the weight. So I had lost quite a significant amount of weight on my own, and I was able to keep it off, although COVID has made me put back on quite a few.
Don't worry, you're not alone.
But coming out of that, it kind of birthed a passion for obesity management and prevention. So when I returned from doing my Master of International Public Health, I went straight into working and volunteering really with the the Healthy Caribbean Coalition. So really we went out to schools and we were teaching the students about nutrition, particularly sugar, and really health literacy in terms of reading labels, encouraging them to do exercise. So that's really a personal passion of mine as well.
Okay, good. So I guess lastly, clearly you're an extremely busy woman.
Yes.
But I know there was a time when you also ran a book club. So I'm just curious, what's on your nightstand these days? What are you reading, or maybe what's the last good thing you've read?
So actually, as we're talking right now, I just picked up this book from downstairs by my mom, and it's called The Universe in an Atom: The Convergence of Science and Spirituality. So I haven't started reading that just as yet, so I plan to start reading it today. But I just finished "You Are Badass at Making Money" by Jim Sincero, and I
Okay.
absolutely love that book. So I would implore anybody out there to go and read that as well.
Well, I have to say I have not read any of these two books that you mentioned, but I do love reading, though I've been listening to audiobooks more lately, but I will definitely check them out and I'll let you know what
Yes,
I think.
no problem.
So thank you so much for joining us today on Shak Dr. Daisley. It really was informative and interesting, and I hope that our listeners enjoyed it and learned something, and that that they will come and see you at the Barbados Family Planning for sure.
Yes, I've been absolutely happy to have them, and thanks again for having me on. And I really do wish you many success with your particular endeavor. I do love the previous shows that you would have had, and I'm really excited to see where you take this endeavor.
Thank you so much. So have a great day.
You as well.
Thanks for listening. Don't forget to join us every other Wednesday for another episode of Shak. Subscribe to our podcast using your favorite podcast platform. We are on Apple Podcasts, Google Podcasts, and many more. You can also connect with us on IG, Facebook, and Twitter, or by email at akilia@shakshak.club. Let's shake things up.